The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Hi, this is Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy. Thanks very much for joining us for this special production of Politically Speaking, Insights and Issues. This coronavirus pandemic is affecting all of us in many ways, but we here at Rogers TV Georgina feel it's important to ensure that accurate information is getting out to you, the public. Following official guidelines, we're conducting today's show remotely. It's only Jeremiah and myself in the studio, and we'll be doing the interviews with physical distancing, interviewing over Zoom. Today, our goal is to try to update you on the best advice to keep your family safe and to maintain financial security at this time. I just want to comment, though, because of the rapidly changing circumstances that we're in right now and all the breaking news reports concerning COVID-19, I'll make the disclaimer that this show is being recorded on March 30th. If you're watching a repeat, certain circumstances may have changed. We will give you links at the end of the show for more updated information. So, my guest today for the first segment is Dr. Alana Fitzgerald-Husek, Associate Medical Officer of Health for York Region. Dr. Alana, thank you very, very much for taking the time today and for joining us on the show. Let's start right in. We did talk a couple of weeks ago with your colleague about the current state of COVID-19 in York Region. And perhaps I'd ask you right now could you update us on what the current state is right now?
Sure, thanks for having me here today. I'm happy to be here and provide some updates to your audience. So since you saw my colleague, Dr. Karchwala, a couple weeks ago, a lot has changed, as we know, within COVID. As of today, March 30th, in York Region, we have over 200 cases of COVID-19 that are lab confirmed. We actually have 212 as of this morning. And as can be expected, what we're seeing elsewhere in the province, we're also seeing here in York Region. We are seeing an increased number of cases, as well as now they're coming in a bit more quickly. And we're seeing some change in the type of cases or where they're coming from. So a couple weeks ago, everything was travel related, and now increasingly we're seeing less travel, but also close contacts of other known cases of COVID are now positive, as well as some local transmission. And
as well as, I'm sorry?
One great piece of news is that we have over 20 of our cases have now resolved and are doing really well.
But there have been 2 deaths in York Region as well now?
As has been seen elsewhere, unfortunately, death can occur on occasion from COVID. So we have had a few deaths. I believe the number is actually now 4 deaths that have occurred in individuals that were elderly and had some underlying medical conditions as well. So it is really unfortunate, but it is something that we did anticipate being an outcome with the increasing number of cases, unfortunately.
Mm-hmm. So, as you mentioned, the last time we spoke with your colleague, pretty well all the cases were connected to international travel or close contact with them. Are we saying then that we're confirming that there is community transfer as the main mode of transmission now? And I'm saying the main mode because looking at the list that you provide, most of the cases seem to be under investigation. So I'm assuming that means community transfer. Is that right?
So I'd be happy to unpack it a little bit for you. And just for your audience, like I'd suggest everybody look at our website, york.ca/coronavirus, where we are updating twice daily information on coronavirus and on the cases. So what we are seeing is there is a change. The majority were travel related before or close contacts of our confirmed cases. We are still seeing over a third of our cases being travel related, but you are correct. Now we are seeing increased local transmission. So what that means is they're not cases that are linked with travel or are close contacts of other individuals, whether travel related. And what we do see and are posting on our website when you're referring to those who are listed as being under investigation is there are increasing number of cases that are coming in daily and sometimes hourly. So we want to make sure that we're giving the information and putting it out there for our communities to know the situation in York Region. So when it says under investigation, what that means is we haven't yet been able to complete our thorough investigation of those reported cases to determine whether they're locally transmitted or whether they're linked to a travel case or close contact of someone else. So as I mentioned, viewers can look at our website to find that most up-to-date information. And as we complete those investigations and can say with a good sense of certainty where those cases have acquired their infection from, then we update the status for those cases on our website. The other thing as well in our investigations that we're doing, in addition to trying to determine where folks acquired their infection from, is also ask them about any other close contacts, whether household contacts or others in their life that they may have been around while they were symptomatic or just before, or any other places they may have been, so that we can help identify those individuals to help prevent against any further transmission of COVID in our communities.
One question I was asked to put to you is concerns the conversation around testing, insofar as that testing still seems to be lagging behind what's needed. Is that the case that we're experiencing here in York Region? And is it perhaps the fact of a lack of testing is understating the number of cases we might actually have?
So I can say that what we see with our hospital colleagues and our assessment centers in York Region and the labs, including the provincial lab that they work with, is there's a lot of testing going on in our communities. Now that can be York Region residents getting tested within our region, and we also know some individuals are getting tested outside of our region. Let's say, in Toronto or Peel or neighboring jurisdictions potentially. We are seeing that a lot of people are getting tested. We do still see a lot of negative, but we are still seeing increased cases. There are considerations being put forth from the province that say that, in the event that if there are limitations in the ability to test, or as the volumes continue to increase steadily, that there would be considerations for trying to prioritize, if there's a shortage, who would be getting tested. So individuals such as healthcare workers or workers in long-term care facilities or some of our vulnerable populations. But as of right now, the majority of folks that are going to have symptoms are asked to complete a self-assessment tool online and see whether you need to go for assessment and potential testing and get assessed at the assessment centers, or if you're really ill, to go into the emergency department if you need urgent medical care. It is true that some individuals may not receive testing. And sometimes we have heard of situations where it's called a clinical diagnosis. So where the evidence of symptoms and say a close link to a known case make the clinician rest assured that this really does seem to be a probable or likely case of COVID-19. And in that situation, it may be possible that a diagnosis might happen without testing.
If most transmission is now moved to a community transfer, is there any different advice that you're giving to residents of York Region now of how they can avoid contracting the virus? What specific advice are you giving the population now?
So just to reassure, at this point, although we are seeing definitely an increase in local transmission, the majority of our cases as of March 30th are still either linked to travel or close contacts of a known case. But we are seeing increased cases the past 2 or so weeks, or a bit longer, in our local transmission. The evidence and the messaging rather that we are giving, really remains the same. And if anything, is strengthened. More than ever now, we're calling on our community members to please do your part in helping protect you, your family, and our community. So some things that you can do every day that are really, really important are to practice what we call physical distancing. So what that means is individuals are, and this is everybody, is strongly encouraged to please stay home as much as you can. What that means is where possible, working from home, unless, you're an essential worker who's deemed that you need to be somewhere else on site, we really want you to stay home. If you need to go out for an urgent medical need or to get groceries, please, we need you to do that. But we would ask for minimizing the number of people that you're going out with and maintaining a distance of 2 meters or 6 feet from those around you when you're out. The other thing too is, the Premier of Ontario a couple days ago announced a decrease for the number of folks that can be gathering. Previously it was 50, right, and now it's 5. And so this just underscores the importance of really us needing to be mindful of the role that we can all play with physical distancing and making sure we're minimizing going out, and that's to protect us and those around us. The other thing I just want to add is, although this applies to everybody, what's really important is, although we're saying physically distant, is we're also saying stay emotionally connected. So it's really important to check in on your family, your friends, your neighbors, those who may, need a little bit more assistance in their community. We're all in this together, and we all have a role to play. And there are some individuals in our community that are at home on self-isolation. So that can be individuals that have returned from travel that must be at home for 14 days afterwards. It's also individuals who are known or confirmed or even probable COVID cases that must be at home on self-isolation, as well as those close contacts around them that are at high risk of developing COVID. As well as it's strongly recommended that elderly folks and those who may have immune compromising conditions or chronic health conditions who may be at increased risk are strongly recommended to stay at home on isolation. And again, what we're asking is that those around them, family, community members, to check in and make sure that folks are doing okay. But to do that in a safe way, so using phone or over computer and checking in and bringing groceries or what things that are needed. So that messaging remains, as well as our usual, and I'm sure people are probably getting tired of us saying it, about the importance of washing your hands well and thoroughly, as well as making sure we practice the respiratory etiquette, cough into your sleeve, and if you're sick or have any even mild symptoms of a cold, please stay home.
So I'm pretty confident I know how you're going to answer this, but because I'm hearing it in the community and people are saying it, I want to pose it to you. Georgina, I think, has just announced its first case of a person who's contracted the virus here. Does that mean that people in Georgina don't have to be as careful, or that we can relax a little bit in that there's some distance protecting this community?
So the messaging remains the same. We really, really strongly recommend and encourage everyone to please heed the advice that we're putting out there about please maintain physical distancing. It's really, really important. You're right that as of March 30th, the first case in Georgina was identified. I believe at this time from our investigations to date, it looks like this case would have been a close contact of a travel-related case, but there is the chance there is the chance that there is transmission that can occur here in our
30 seconds. Okay, we were losing our connection, and you faded out in the last bit there, but listen, Dr. Fitzgerald-Husak, I really want to thank you for taking the time today. I know how busy your time is right now in trying to follow up, and thank you very much for your work and your efforts. Stay with us for after the break. We're going to come back and talk about some financial health issues. back to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy. The COVID-19 continues to take its toll, as well as the physical health considerations that we just discussed in the last segment. The pandemic is negatively affecting the financial well-being of families across the province. The COVID-19 pandemic is leaving many households financially vulnerable. In this section of the program, I am joined by Zoom with David Nerona, Senior Vice President with BDO First Call Debt Solutions. David, thank you very much for taking the time and joining us here today to talk about this.
My pleasure. Thank you for having me on.
I want to start right in because people who previously may not have considered themselves in precarious employment are now facing real financial stress. What can they do about creating a financial plan?
Okay, well, the thing that we stress the most, and if it hasn't already been done, is hopefully a lot of people have an emergency plan or an emergency budget. In most instances, they probably don't have something like that. So if they don't, now more than ever is the most important time to take stock of that process. So what we first want to encourage people to do is to take a really, really deep breath, because they're being overwhelmed by so many things these days that if they don't take a step back and they start going at things haphazardly, I think they're going to end up doing themselves more damage than good. So take a deep breath, try and have as much of a positive outlook as you possibly can, and then sit down and say to yourself, okay, what am I faced with? What do I have to deal with? And what are my resources right now for helping me get through this period? Because right now, because we're so uncertain as to how long we're going to be in this, whether we can go back to work, whether our jobs are going to be there, we need to try and map out a plan to deal with this. And how do you do that without knowing where you're starting from? So you've got to figure out where you're at, what you've got to deal with, what your resources are, so then you can deal with it moving forward. And at that stage, you've got to look at your resources and say to yourself, what do I have to deal with first? Obviously, you've got to deal with food. You've got to deal with rent. Those are the two most important things right now that you have to deal with. And do you have the resources to take care of that? And if you don't, then you have to look at your budget and say to yourself, where do I start trimming back? Because right now, the budget is your roadmap in dealing with this going forward. So if you have to tighten your belt a little bit, that's what you need to do now, because you need to remember it's not really for the long run per se, but right now you've got to put in place things to help you survive the current situation.
Now, I think you said half of people, working people, have no plan in place to deal with a loss of income like this.
Well, the statistics, and we've done a lot of this research in the past, and actually even last week when this thing was starting to hit the newspapers and people were becoming more aware of it, the numbers indicated approximately 75% of people were already beginning to stress out about it. And then when we did our studies last year, we were seeing more and more people were struggling with their budget even before the COVID-19 issue. So you can only begin to imagine how this is now snowpiling on people, because if they weren't prepared before, they're definitely not going to be prepared now. And again, sitting down and putting pen to paper to figure out what your resources are and where you have to spend money, if you haven't done it before, you might feel a little bit overwhelmed to do it now, but it's really, really critical that they take the time to do that, because if you don't know what you've got, you don't know where to spend the money.
So, given the situation people are finding themselves in right now, what are the advantages and pitfalls of using credit at this time? And what forms of credit would you suggest are the best to be using, accessing?
That's a really, really good question. First choice, if you've got the emergency fund or some sort of nest egg that you can rely on, I would look to that first. Now, when I say nest egg, I don't mean your retirement funds. I don't mean what you've put away into your RRSPs, because now is probably the worst time to cash in those RRSPs because they're probably undervalued. And if you cash them in now, you're incurring a tax debt as well, which you're going to have to deal with later on when you file your taxes. So I don't or at least I'm not a big fan of cashing in your life savings right now to try and ride out this storm, which again, we hope is a really short period of time. If you've got those resources other than your savings or your retirement funds to rely on, those are the things that you've got to rely on right now. So if you've got some money in the bank, shift it from dining and entertainment if that's where you were going to spend the money, and probably now's the best time to do that because you're not going out anyways, and use up those resources first. If you have available credit, you've got to be aware of the fact that, again, you're adding to your debt load. So if you're already struggling with debt right now, adding more to it at the moment may not be the best idea. If you have to, I completely understand the need to do that, but then take stock of what interest rates you're going to be paying. So if you've got a line of credit that you can rely on, or a home equity line of credit that has a little bit of room in it, that's probably where I would start first, because typically those are the lowest interest rates that you would have to pay on borrowing those funds. Credit cards are extremely high interest rates, so I wouldn't rely on those unless you absolutely have no choice. Lenders of last resort, I would run and hide away from. Payday loan places, Easy Financial, those sorts of places, because the interest rate that you pay on those things is ridiculously high. You might think you're getting a little bit of relief now, but you will really regret the day that you borrowed money from those people, because what you have to pay back is ridiculously high.
So what about some of the other financial investments? I'm glad you made the comment about RSPs, because I think for a lot of people that is the only financial backup that they have. But if people have tools such as other financial investments, non-registered mutual funds or bonds, what about accessing those kinds of investments? What would your advice be in that regard?
Again, when you're accessing funds that have been put away for your retirement, keep in mind, if you're using them now, they're not going to be there later for you. So you're going to have to review again what your retirement plans are after that date. My biggest concern is twofold when you access those things. The fact that if you're cashing them now, they're probably at their lowest value that they've ever been, so you're not going to be getting as much as you think you are. And you're going to be actually adding to your debt requirement, because at the end of the day, you're going to have to pay taxes on that as well. So again, you're finding a little bit of relief, but once you've accessed it, it's gone. You almost might be better off, if at all possible, to use your line of credit or a home equity line of credit if you absolutely have to. But again, I'm not a big fan of using credit or cashing those in unless you really have no choice. And if you're really not sure, talk to your financial advisor. So if you've got somebody that you've been using in the past, that might be somebody you want to talk to. Again, if you're not absolutely sure, call a professional in that area to say, you know, what would happen if I did this? What is my downside? Because a lot of people wouldn't think to do that before they actually access those funds. And again, once you access it, it's gone. You can't replace it right away. Whatever you've accrued up until now, its value, it's going to take you just as long, if not longer, to put that value back in, and you may not have that time left. So again, if you've got to do that, talk to somebody first before you do it, because once it's gone, you're not going to be able to replace it.
Now, I understand what you're suggesting with the line of credit or home equity line of credit is an available source of financial support if you have that asset. A lot of people don't have that kind of asset available. And for renters, rent is now coming due. I know the Ontario government has placed a freeze on evictions during this crisis, but that being said, Ford has made it clear that rents will still be expected to be paid. What can renters do in this kind of circumstance?
Okay, so that's a really interesting question, because it's almost on a case-by-case basis, because a lot of people have formal arrangements with landlords. Some people have informal arrangements with landlords. To me, communication is the important part about this. Recognize that the rent is going to be due in all likelihood on Wednesday, April 1st. If you haven't already done so, I would strongly suggest that you speak to your landlord. advise them of what situation you're faced with and see if any kind of accommodation can be made. I don't know what the landlord situation is like. So again, a lot depends on what they're faced with, because they may have loans and mortgages that they have to deal with as well. So from their standpoint, they may be stuck having to make a payment also. So when it comes to those kind of payments, talk to the landlord and see if a portion of it can be deferred. You're not in all likelihood going to get a waiver or some kind of reduction in the rent, because the landlord in all likelihood needs the income, but ask for them to defer it to a later date, so maybe you can get caught up, or they can add it on to the end of the rental agreement. That leads to the mortgage question, where, you know, if you own your home and you're struggling to make your mortgage payment, again, communication is important. You've got to contact your bank right away. Some banks have made it known that they will defer mortgage payments. Again, it's a deferment, which means you'll have to pay it at some point in time, but you've got to reach out to them, because the banks aren't going to reach out to you. Your landlord isn't going to reach out to you. And that would even extend to credit card payments. So if you've got a credit card bill that's due, you've got to be proactive, and you've got to notify the bank and find out what is in place and what you can apply for, so that you can maybe, again, defer that payment, maybe get an interest rate deduction on it. You don't know, but those are all steps that you need to put into place and do now. Don't wait for them to get a hold of you, because your likelihood of getting some sort of relief is better now than later, because they're being inundated with all of these, so they're more likely to accommodate you at this point versus when things start settling down.
I'm wondering about people who are nearing retirement age right now, or perhaps even more appropriately, people who are at the age where they have to start withdrawing from their RSPs or their RIFs. What advice would you be able to give people in those situations?
So in those cases, if you're going to be doing it, and you were going to do it before the COVID-19 situation applied, you're almost stuck having to do that, because that's your sole source of income. So again, it's unfortunate that the timing is off. Maybe they don't have to withdraw as much as they originally had planned. And again, that comes down to knowing what you need in order to pay for the things that you have to in the short term going forward. So if you had planned originally to deduct more, now's the time to probably say to yourself, I really should reduce what I have to take out of it, because again, the value of that's probably not as high as it used to be. So you need to know what your budget looks like, so you know what you have to withdraw in order to pay for what needs to be paid for right now.
Mm-hmm. What if the COVID-19 crisis is the tipping point for people? What if it's pushing somebody over the financial edge? What recourse can they look to?
Oh, and that's where we get into the debt solution equation. And that's where it's really, really important for people who are faced with that, or even suspect that they might be faced with it a month or 2 months from now. It's important for you to get the right information from the right people. And when it comes to debt solutions, you must speak to a licensed insolvency trustee. Those are the only people that are certified by the federal government to offer you the debt solutions that are legal from the standpoint of being protected by the Bankruptcy and Insolvency Act. So what we're doing right now is, even though we're at home like everybody else trying to work from home, we're making ourselves completely available by email and by phone call to help answer those questions. And we're fielding those calls right now, even as we speak. So we encourage people who say to themselves, you know what, I know I'm going to hit the wall at some point. It may not be today, it may not be tomorrow, it might be next month or the month after. Don't wait to get those answers, because I'm dealing with a lot of people right now who at the moment may not need my help, but they just want to know what their options are. So they're calling us, and we're giving them the solutions to their potential problems, so that they're ready, if that were to happen, to then make sure that they do the right things to protect themselves from their debt.
David, thank you very, very much for taking the time to update us on what's necessary for financial health at this time. Stay with us now as we come back in the next segment for advice for people regarding the new federal government program. Welcome back to Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy, and we're going to carry on with the third segment now of our special COVID-19 edition, Zoom edition of Politically Speaking. And we're confronted with a situation in Canada now. 2 million Canadian workers have been laid off or classified as immediate risk of layoff as a result of the public health measures to combat COVID-19. Now, that's according to an analysis given to us by the Canadian Centre for Policy Alternatives. The federal government has released a support package which has been analyzed by my next guest, Pam Frasch, coordinator of the Fight for $15 and Fairness campaign. Pam, thank you very, very much for joining us today on the show.
Thank you very much for having me.
So let's talk about this package, if we could, first, please. The Canadian Emergency Response Benefit. What's actually in that aid package?
Right. Well, this is the government's effort to simplify two programs that they had announced about 10 days ago. They had promised more or less an EI sickness benefit for people who don't qualify for employment insurance, and they had promised a support benefit for those who don't qualify for employment insurance. What they've done with the Canadian Emergency Response Benefit is to combine the two benefits, so for sickness and for loss of work, and made it available to workers who don't qualify for employment insurance. And this is an important step forward. It's something we were calling for at the very beginning, because we know that on a good day, about 60% of workers who are unemployed don't get access to the EI income supports that they need. And so this is a step to address this in the context of the COVID-19 crisis.
So it's the separate emergency support benefit, emergency sickness benefit have been merged, and that's seen as a positive then.
Exactly. And anyone who has been affected directly or indirectly by COVID-19, so if you are a gig worker and you've lost income, if you've had to stay home with a child to look after, if you've had to self-quarantine, these are all covered now through the emergency benefit, and it provides $2,000 per month for 16 weeks. So the equivalent of about $500 in weekly income supports.
Okay. So even that then is now an improvement on the previously announced benefits, I believe. And you've talked about that it's covering far more people than normally would be covered under the EI program. Is that that's what you're saying?
Yes, exactly. And it's to deal with the incredible influx that we're experiencing today with COVID-19. But I think it also I hope it reminds all of us that our existing safety nets need great enhancements in order to be there when we all need them in the future.
Mm-hmm. So this idea of it's covering, you said now, I just want to go over that list again. So if someone has been laid off because their work has been, their business has been closed down as a consequence, if the person themselves is sick or they're under quarantine, somebody who's caring for someone who's sick or under quarantine, correct?
Mm-hmm.
And
or children.
Or children. Mm-hmm. And those without enough work hours or were on unpaid leave.
It's the specific regulations say people who have been without income for 14 consecutive days, whether that's because the school's closed and you had to suddenly be home to look after your children, whether that's because you're having to self-quarantine, whether that's because you've had a loss of income or a loss of job.
And now the process is designed to be faster than EI application process as well, correct?
Yes, they've simplified the process. And so as soon as the application process is ready to go, and they've said early April will be when it's ready, everyone will apply for their supports through that process. So whether you're EI eligible or not, so people who are self-employed, who don't normally contribute to employment insurance will be able to apply through this portal. And what it basically means is that people who are eligible for the CERB will be getting, as quickly as they can turn it around, the $2,000 in monthly income support, and those who are EI eligible will be taken in that same portal. So it will streamline it for sure.
And I think that's probably the key aspect of this plan, because prior, people who were in what you referred to as the gig economy, or people who were self-employed, or in other ways not eligible or had not been contributing to employment insurance benefits package, are now able to receive this $2,000 a month.
Exactly. The requirement is that a person has to demonstrate that they had $5,000 worth of income in the previous 12 months, and that they have experienced 14 consecutive days with a loss of income. And if they meet those criteria, they're able to access the Canadian Emergency Response Benefit.
Now, I'm just looking at some other aspects to this package too, if we can. There's also a boost to the Canadian Child Benefit payment?
Yes. And those are all good for people who are already in the system, but those won't be delivered until May. I'm happy to talk a little bit about some of the challenges with the CERB, the Canadian Emergency Response Benefit, as well.
Okay. Well, here let's go on with that, because I just want to cover. So the other items, a boost to GST rebate as well is included.
Yes, and again, it looks like they're sort of upfront loading the rebates that people would have experienced, and we'll see if that winds up to be a replacement or whether it's a front loading of the GST credits.
Canadians carrying student loan debt. There's a moratorium on interest on that?
Yes, payments and interest for 6 months.
Okay. And of course, there's also the deferring of requirement to file taxes. That's been moved away, right?
Yes. Until August, I believe.
Okay, good. August 31st. But in your media release, you said about the government program, it's promising, but urgent improvements are needed to get support where it's needed most. I have to ask you, so what more is needed? What improvements need to be put in place?
Right. And again, we are happy the government is moving forward the way it has, but there's a couple of big problems with the program right now. So first of all, if you are a person who's receiving employment insurance, right now, you can't apply to the CERB, the Canadian Emergency Response Benefit, until you have exhausted your EI income support. And the big challenge is that for anyone who is a minimum wage earner or a part-time worker or doesn't have 35 hours a week, EI only provides 55% of income. So what that means is that workers are trying to survive on EI income supports that are significantly less than $500 a week, which is what is being offered through the Emergency Response Benefit. And keep in mind for your viewers that in some provinces, the minimum wage is even lower than it is in Ontario, which is scandalous because the $14 minimum wage is still below the poverty line. There are provinces where the $15 or where the minimum wage is only $11.32 an hour. For people trying to survive on 55% of that is an absolute disaster. And so what we are calling for is to make sure that everyone who is receiving EI benefits now receives no less than $500 per week. That is the minimum amount of supports that we think is necessary for anybody to survive on. And those are, and it's in keeping with what has happened with the Emergency Response Benefit. We think that that's fair and that's a way of protecting everyone. The other concern is that there are people who don't yet have a social insurance number, and we need to make sure that we're finding a way to protect all the workers who are contributing to our economy. So whether that's newcomers or refugees or international students or others who find themselves in circumstances beyond their control, people who are working and contributing also need to make sure that they get access to those same kinds of supports. So we want to make sure that those support systems are there for everyone.
So we've caught then the plan is positive, but it's missing some people. How do you see your next steps in terms of trying to address those problems and catch those people that are falling through this net?
Yes, exactly. Well, for employment insurance, it would be very easy as an emergency measure for the government to move now to make sure not a single employment insurance check is issued unless it is at least $500. So we want to make sure that that happens as quickly as possible. We think it's doable. It is not a complicated step that would be required by government, so we think that that's doable. And we're also urging government to talk to those organizations and to consult with those organizations that are on the front lines working with refugees and international students and other workers who may not yet have a social insurance number, to work out a plan to make sure that those workers are also protected as well.
A very important question now, please, Pam. How does one apply for these benefits? How do people get into the system to make sure they receive that kind of financial support?
Yes. So the application process for the emergency response benefit for CERB is not going to be available until early April. But once that application process is up, people will be able to apply through Canada Revenue Agency accounts. And so for those who are able to, we recommend that if you don't have an account set up, we recommend that you get that account set up as soon as you can. And for those who have been laid off, whose EI income may be more than $500, we urge you to move now to apply for employment insurance. Don't wait, because it may affect your claim. So keep moving now. What we've been told is that anyone who is applying now through the system will be basically channeled into the correct stream on a go-forward basis. And we've been told that that for those who are eligible and qualify for CERB, that the checks will be circulating within 10 days of having applied. So, I mean, that's a huge problem, just generally speaking, for people who have been in precarious employment and who are currently without income, to have to wait even one day for wages. But having to wait these days is going to be a huge, huge hardship. And we know that food banks and other frontline organizations are doing their best to help people cope in those circumstances. But that's, as we understand, the earliest the CERB benefits are going to be available will be early April. They were suggesting at one point April 6th, but I think lately that the language has been a little bit more flexible on that, but with a commitment to a 10-day turnaround as soon as the application process is up and running. And I will also just say some of the details have not yet been released because the legislation was just passed last week and people are working right now on the details. And that's why we are calling on your viewers to join us right now in calling their member of parliament to make sure that anyone getting EI is also going to get at least $500 a week in income support, because this is when the details are being worked out. And so your viewers can call their member of parliament, make sure that we're calling for minimum supports for everyone, for those, and especially for those receiving EI, and especially for those without social insurance numbers. And for more information, people can visit our website, 15andfairness.org.
Before we leave, I want to talk about the provincial plan as well. Everything you've been talking about has to do with the federal emergency plan, but the Ontario Action Plan has been announced as well. Does that assist any further in helping low-wage and precarious workers to stay home when they're sick without financial hardship?
Well, sadly, we've been quite disappointed in terms of the direct supports for workers, because all the public health advice tell workers to stay home when they're sick, whether it's COVID-19 or whether it's the common cold. Workers are told to do this, but there's been no protections put in place for workers to do this. And we've been profoundly disappointed by provincial and federal governments at the absolute failure to legislate a minimum number of paid sick days for all workers.
Okay, thank you very much, Pam. I'm going to have to end it here because we've run out of time for this segment. Thank you very much for taking time away from your meeting and coming to speak with us about how to access the emergency funds. Stay with us. We're going to be summarizing what we've been talking about today on our next segment of Politically Speaking. Thanks for staying with us on the special Zoom edition of Politically Speaking, Insights and Issues. I'm your host, Dave Szollosy, and I'm joined in this last segment by my colleague and host of my sister program, Politically Speaking, Karen Wolf. Karen, thank you very much for joining us today.
Well, thank you very much for having me, and greetings from the beautiful town of Pefferlaw. And, I think Pefferlaw is doing a great job of doing the social distancing.
Okay. Now, Karen, you've been with us throughout the whole show listening in, and I want to ask you, what takeaways have you drawn from the interview with our three guests today?
You know what? I've been impressed by all three of the guests you had today. I think they've delivered some very important information that really is critical to the COVID-19 situation that we find ourselves in, especially helping us navigate through this from a health perspective and a financial perspective. So I think all three guests have been great. That's number one. I do have some thoughts about, well, obviously, I've been listening to the news and watching a lot going on television, online, reading everything I can. And to be honest, Dave, the best advice that I've heard throughout all of this, I think came from a doctor in the UK. And he said, the one thing we need to do is to assume everybody is contagious and overreact. And I thought, wow. And he went on to explain why he thought that. And then today I also listened to a doctor in Manitoba, and she said she believes that we should be at a stage right now where everybody should be wearing a mask and everybody should be wearing gloves, because you have to assume that everybody is contagious. And that way, we're really going to cut down on the ability for people to spread this disease. And we might be overreacting, but what a great thing story we might have to tell when this is all over.
I still feel too, there was something that came up in the last segment with Pam Fraiche, just at the end of it there, when she was talking about the allowing people access to paid sick leave. That still, even within the Ford government's special Ontario Action Plan, that provision of paid sick leave for people who are feeling sick and should be self-isolating still hasn't been returned. It almost at times, what I get worried about is that one arm of government isn't responding to what the medical officers of health are saying on the other arm. Are you picking up those kind of contradictions as well?
Well, I was just wondering, is that covered under the emergency benefit plan that the federal government came up with?
Well, here we go. We're lost. That if someone is self-isolating, clearly because of exposure to COVID-19, I think the federal plan is specifically identifying people who are losing employment or losing income because of the COVID-19 pandemic. But people who are otherwise ill still don't have access, or have not been diagnosed yet with COVID-19, don't have access to paid sick days. And it seems to me that's still a strong hole in the system, something that they did have before, but was taken away from them before this pandemic hit.
Yeah, I understand what you're saying about Ontario, but I'm just wondering if it's covered by the feds, because if in fact you are told to go home because you have sniffles, you're told to go home, I would think that your loss of income would be covered by the federal plan. Because the only reason they're sending you home is because they're so afraid that you might have COVID-19.
Yeah, and I think that was the case. There's the distinction there that you're making. That's really important with the federal emergency plan. It's if you are sent home, as opposed to if you are otherwise ill. And there's where the gap fits in. But I want to ask you something else. The other problem I still see happening, and why I think doing shows like this is so important, is to get the good information out to people. Are we still
Yeah.
seeing a lot of misinformation and misdirection and actually dangerous information coming out from some sources?
Well, absolutely. I mean, the biggest one that I can think of is certainly, Mr. Trump. He is taking such a cavalier attitude toward this by saying, oh, we should be back in business by Easter. I mean, what a terrible thing to say. Because what does that do? And it's misinformation. Nobody agrees that this is going to be over that quickly at all. In fact, we're probably going to be at the height of the curve by then. So
we have.
When you talk about misinformation, I mean, how do you stop that hole?
Yeah, yet at the same time, I think we have columnists in this country too, like in post-media publications, who are saying quite dangerous things, and we defend them in the sense that, well, isn't it important to have both sides out there? And I like the comment of Davide Mastracchi in the North 99 newsletter, who simply says, no. In a case like this, as the BBC says, when it comes to topics like climate change, where one side isn't operating in reality, you don't have to provide that side.
Yeah,
Karen, thank you,
I mean,
Karen.
I go back to my opening comments here that we, overreact. We have to overreact on this.
And that'll be the message we're going to have to leave on because we've run out of time. Karen, thank you very much for joining.
Thank you for having me, and good job, Dave. This has been a great show.
Well, it's fun doing it on the Zoom format. It gave us some additional challenges. Thank you very much to the audience. Stay with us for the next edition. Next time we update on Politically Speaking Insights and Issues.